Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Tram track appearance when you're looking at various diseases. So tram track is also known as the tram track signs. So they are the medical signs that bear some resemblance to the tram tracks. So in short, it is nothing but also known as a railway track. So it is a similar appearance of that of the railway track. So first is in terms of pulmonology, where is a tram track appearance here? In pulmo, when found in lungs, the tram tracks are radiological signs that are usually accompanied by the pulmonary edema. So they are found in terms of the pulmonary edema, and this pulmonary edema is the case of the congestive heart failure as well as the bronchiectasis. So congestive heart failure, CHF, or the bronchiectasis, or it's also present in the bronchiectasis. Next is the tram tracks are caused by the bronchial wall thickening. So if you look at the TT, the tram tracks, so they are caused by the bronchial wall thickening. Bronchial wall, B wall thickening. And it can also detect the lateral chest X-ray. So it also detects the lateral. So it detects the lateral chest X-ray. Next, we move on to the nephrology. So under nephrology, what is present? So in pulmonology, to recap, we saw the pulmonary edema, cases of congestive heart failure and bronchiectasis, as well as the bronchial wall thickening, and it can also be detected on the lateral chest X-ray. Next, we move on to the nephrology. So in nephrology, the tram tracks is also used to describe the basement membrane duplication. So it is in the BM duplication, basement membrane duplication. So basement membrane duplication, and it is found in the light microscopy. So it is found in the light microscopy. So it is found in the light microscopy, and the characteristics of the membranoglomerular MPGN, the membrano proliferative glomerulonephritis, MPGN. This is the type 1, and it is less commonly associated with the type 2 and 3. So it is less common in terms of the type 2 as well as type 3. Next is we move on to the neurology. So we move on to the neurology. So here in neurology, the term has been used to describe the findings associated with the optic nerve sheath meningioma. So it's an optic nerve sheath meningioma. And the tram track calcifications in the cerebral cortex. So they can also be present in the calcification, tram track calcification. They are found in the cerebral cortex. So tram track calcifications are seen in cerebral cortex. So it's found in cerebral cortex, and it indicates the Sturge-Weber syndrome. The Sturge-Weber syndrome. Next is we move on to the mammary glands. So under the mammary glands, how is it? What are the conditions? So under the mammary glands, the tram track in the mammography. So in terms of the mammography, as well as in terms of the USG. So mammography of the USG, what does it indicate? It indicates the presence of the duct ectasia. So it is the presence of the duct ectasia. To learn and grow daily like this, please do subscribe.